So the current state of bone fusion in extremities, or in my case, orthopedic foot and ankle surgery. We use fusion surgery for a lot of cases in this specialty, and the reason for that is severe arthritis. There's either a joint replacement or a joint fusion, and joint fusion is a very good operation. Certainly for many of the bones in the foot and ankle, they're stiff, and so you convert a stiff, painful joint into a stiff, painless one by fusing it. And when you're trying to fuse those surfaces, because there's not congruent surfaces, there's a round surface on a flat surface, what you're trying to do is to try and get those surfaces to join together and become one. And there's always a void, and so we typically use a bone graft to fill those voids and to encourage bony union. And about the majority of foot and ankle surgeons use either autograft taken from the patient themselves, which obviously carries downsides, allograft taken from somebody else. Both of those are human tissue, and the alternative is a synthetic type of calcium sulfate, calcium phosphate graft, which accounts probably for about 20% of the market, and about 80% is human tissue. To have a successful fusion operation, you're trying to get a number of factors to come all together at the same time, to coalesce, to come together. In particular, the most important thing is doing the surgical technique the most appropriate way possible. You remove all the articular cartilage, you put two exposed cancellous surfaces together, and you somehow hold them in that position, either with an external plaster or with hardware, metalwork, which we typically use, preferably with some compression, but also to prevent rotation. No bone graft in the world, no biologic is going to surpass if the surgeon doesn't do that part of it properly, and so that's the most important part of it. But given that the shapes of the bones are abnormal and there's often voids, then augments that include biologics are often very helpful to, in particular in those spaces, to create the right environment for the good surgery to then lead to a good outcome. And obviously you can't affect patient variables, and patients may have low vitamin D, they may be smokers, diabetics, non-compliant with their rehab, and there's nothing that you can do to supplement that, but you can try and optimize the surgical technique, and we can optimize the use of biologics when appropriate.